This is an ultrasound video segment of a female pelvic study. She came with pain in the pelvic region and pregnancy test positive. The pain was severe. So let's study first the uterus in longitudinal section. This is the longitudinal section of the uterus. Now if you see, this is the myometrium. This is the fundal anterior wall. If you see, there is a tiny cystic area in the center of the endometrial canal, this one, surrounded by a thin echogenic rim which is complete and not broken. Complete echogenic rim, in the center of which is a tiny cystic area. Now this may be suggestive of very early pregnancy, say 3 weeks, because this central echogenic area with pregnancy test positive and echogenic area around it, which is the double decidual reaction, or we also call it the trophoblastic ring. It has two names in different textbooks. Somewhere it will be written as trophoblastic rim, or and in other, most commonly used is the double decidual reaction, this echogenic bright area around the cystic area within the center of the endometrial canal in the longitudinal view of the uterus. Now if you see, this is a thin layer of fluid posterior to the uterus. This line is the fluid. Small amount of fluid below the uterus. Now there is another echogenic area around the cystic area, thin rim of echogenic area, and there is one more echogenic area around that. So cystic area, another one echogenic area, and the second echogenic area, which is the endometrial canal, that measures approximately 27 millimeter in anterior-posterior diameter. Now let's return to the transverse section of the same patient. This is the uterus in transverse section. This is the uterus in transverse section. This is the myometrium. Again, if you see that in the center of the image, there is an echogenic area, this echogenic area, which is surrounded by a thick echogenic rim, which is in turn also surrounded by an echogenic area, which is now this is the endometrial canal with a tiny cystic area within it and encircled by a echogenic ring. This is the urinary bladder transverse section. So this is a case of very early pregnancy, 3 weeks pregnancy, intact, because when the decidual reaction is intact, the trophoblastic ring is intact. So, and there is no perisac fluid anywhere. We will consider it as a normal pregnancy, early pregnancy of 3 weeks. Now this fluid, the significance of the fluid, the pain the patient feels is because of this fluid. If she is having PID, it will be addressed by the referring doctor. So we will report accordingly that the uterus, in the uterus we see a cystic area surrounded by an echogenic rim, and keeping in view that pregnancy test and beta ICG, pregnancy test is positive, beta ICG is raised, so this is a very early pregnancy of 3 weeks with minimal amount of fluid in the pelvic cavity, which is possibly indicative of pelvic inflammatory disease.